Well, hey guys, happy Valentine's Day week. It's yet another holiday, so a good reason for me to keep using my giant Happy Holidays mug. And hey, then we have President's Day, so let the party continue. In today's video, I'm going to be talking all about some of the most common causes for hair loss. I know it's something that a lot of you cope with or struggling with right now. It's really frustrating, emotionally devastating to be losing your hair. So hopefully in today's video, I'll clarify some of the most common reasons for hair loss. Reason number one, unfortunately, is your genetics. I think this surprises a lot of women. We always think about male pattern hair loss or male pattern baldness as being something that has a genetic component to it, but women can go through this as well, and it definitely does have a genetic component to it. But the presentation of pattern hair loss in women is a little bit different than in men. It tends to be focused more on the top of the head, whereas in men it's more of a receding hairline. But it's the same type of hair loss, and there is a genetic component. It's called androgenetic alopecia. But yeah, in women it tends to focus on the crown and presents as a widening of the midline part typically. And this can occur around menopause for many, but even earlier in life. So it's related to kind of changes in hormones, and probably to a certain extent the hair follicle seems to be maybe a little bit sensitive to androgen hormones in the body. And that's what kicks this off and causes this for people. Treatments for androgenetic alopecia include things like Rogaine and some oral medications. Now I have videos all about androgenetic alopecia, so check those out. There's also low-level laser therapy that is incredibly useful. So I've got videos on that as well. Yeah, androgenetic alopecia is probably one of the most common reasons for hair loss in adults. Another reason, though, in women is going to be a childbirth, and here's what goes along with that and why that happens. The hairs on your head are all in different stages of the hair growth cycle. The majority of the hairs in your head are in the stage of the cycle where they're growing, and they spend the majority of their lifetime in that stage. Then they go into a resting stage, and then they're shed in what is called telogen. But what's interesting is that during pregnancy, we have an increase in estrogen hormones, and estrogen shifts many of the hairs into that growing stage. So you get more hairs in the growing stage than you normally have. And therefore, when you're pregnant, you may notice, wow, my hair is a lot thicker, it's growing, it's a lot longer, it's a lot denser. But guess what? After you deliver, or after you have your baby, all of a sudden those hormones go back to baseline. So all of that hair that was recruited into the growing stage of the hair cycle now undergoes the remainder of the hair cycle, and then it sheds, and that is what is called a telogen effluvium. So many women after delivery will experience hair shedding to a certain extent, but for some women it goes on for a long time and can be incredibly distressing. There is a lot of person-to-person variability in the degree of that, but that will normalize with time, so long as there are no other hormonal changes going on, or some of the other reasons for hair loss, which I'll talk about in a moment. But at its root, that is what is referred to as a telogen effluvium. Pregnancy is a unique situation for telogen effluvium, but there are some other reasons for telogen effluvium that I'll talk about in a moment. Similar to pregnancy though, another common reason for hair shedding is starting, stopping, or changing your birth control pills. Birth control pills usually have some combination of estrogen and progesterone, although there are some birth control pills and methods that are progesterone only. And regardless, when you start these medications and or stop or change to different types, it definitely can play a role in where those hairs on your head are hanging out in the hair cycle, and you definitely can experience a telogen effluvium around starting and stopping birth control pills. And this can go on, typically starts about 3 months after the change, so you may not realize that that's what's going on. And a common situation for women is they deliver, a woman may be pregnant, delivers a baby, and then goes through the telogen effluvium related to postpartum, and then she tries to then she's going to go on a birth control pill or a birth control method. Maybe she'll be on one method that's more compatible with breastfeeding, then she'll stop that and change to what she used before. So that's a lot of starting and stopping different birth control pills in that same time period. So those are different kind of factors that are gonna contribute to the telogen effluvium. Pregnancy and birth control pills is obviously unique to women, but another common reason for hair loss is medications in general. You know, I obviously mentioned birth control pills, but there are a ton of other medications that can cause hair loss. A blood pressure medicine that people take called propranolol can definitely do this, and a lot of people take that medication for situational anxiety, performance anxiety, because it has kind of a calming effect to it. It's a beta blocker, and that medication can kick off a telogen effluvium. Systemic steroids can impact the hair cycle and cause hair shedding when you start and stop them. They can interfere with the progression of the hairs from the resting stage back into the growing stage. And by systemic steroids, I mean prednisone. Antidepressants also can contribute to telogen effluvium or cause telogen effluvium, as can retinoids. Oral retinoids like Accutane can cause a telogen effluvium. I get a lot of questions on my Accutane video. Does this cause hair loss? It certainly can cause a telogen effluvium, but you should know that that type of hair loss is not permanent, so it's not causing permanent balding. Once you're done with the Accutane or the oral retinoid, the hair will eventually go back to normal. And then certain medications for seizures like carbamazepine, phenytoin, and valproic acid also can cause hair loss. And many people are on these medications for things other than seizures, specifically migraine headaches. A lot of people take anti-seizure medicines for their migraines. And of course, obviously, in terms of medications, chemotherapy certainly is associated with hair loss. Starting chemotherapy is associated with a type of hair loss called anagen effluvium, a little different from telogen effluvium, in that it actually affects the majority of hairs on your head that are all in that growing stage. But chemotherapy and going through chemotherapy itself is very stressful as well. So that's a stress on your body and can be associated with thinning of the hair for a long time after your hair begins to regrow. It can be much thinner for quite a while. Outside of medications, another reason for hair loss is a nutritional deficiency. This is not as common, but it certainly can occur. One nutritional deficiency that is associated with hair loss is iron deficiency anemia. There can be many different reasons for an iron deficiency anemia, and it requires a comprehensive workup. Most people just assume that it has to do with your diet, but sometimes it might be that you are losing blood from somewhere. So there's a more comprehensive workup that is typically initiated to investigate an iron deficiency anemia. But yes, hair loss can be associated with that for sure. Another deficiency is vitamin D deficiency, has been associated with hair loss as well. Vitamin D deficiency is very common nowadays. We're not entirely sure as to why. We don't think it has anything to do with wearing sunscreen. We actually have very good studies showing that sunscreen does not seem to interfere with vitamin D levels. So anyways, vitamin D deficiency certainly can contribute or be associated with hair loss. And then zinc deficiency is another potential source of vitamin deficiency that has been associated with hair loss. So that's something that, you know, with any kind of hair loss, I should have mentioned this at the beginning, it's very important to see your healthcare provider first before jumping to conclusions about the cause of your hair loss. And you know, perhaps they can refer you to a dermatologist for an appropriate workup of evaluation of your hair loss to determine the cause. I should have said that at the beginning, but yeah, don't just self-diagnose, in other words. Getting back to telogen effluvium though, I talked about it in terms of pregnancy, and starting and stopping birth control pills, as well as with other medications, but there are a variety of other things that can cause a telogen effluvium. Basically any severe stress, whether it be emotional or physical. So some people will develop a telogen effluvium if they go through a particularly stressful time at work. It's not uncommon to have hair shedding 3 months after the fact. Having an illness can affect the hair cycle and be associated with telogen effluvium, specifically having a fever. You know, you may be sick with the flu and have a fever. 3 months later, you have hair shedding. That is not uncommon. But any kind of severe illness can be associated with telogen effluvium, it puts a stress on your body that affects the hair cycle. Not only illness and fever, but also surgery. If you have a surgery, that is actually very taxing on your body and viewed as a stress. During surgery, the last thing that your body is going to be prioritizing is growing hair. So it's not uncommon at all to experience a telogen effluvium 3 months post-op. Any form of crash dieting, rapid weight loss, of course, can trigger a telogen effluvium. If you participate in endurance sports and you train for something like a marathon, don't be surprised if 3 months after the race you develop a telogen effluvium. Because when you're running a marathon, the last thing that your body's going to be prioritizing is growing hair. So it's not unusual at all to experience a telogen effluvium after training for something really intense like that. And be aware that not only do you have the event of the marathon itself, I'm using that as an example, but you also are doing some intensive training leading up to that. So you may have shedding for quite some time after the race. Diseases of the endocrine system certainly can be associated with telogen effluvium. Probably most common is hypothyroidism. Having low thyroid hormone certainly will cause a telogen effluvium. Another common reason for hair loss is actually dandruff or psoriasis in the scalp. These are conditions, inflammatory skin conditions that affect the scalp and cause a lot of inflammation, scaling, and that inflammation in the scalp can cause hair breakage and also can affect, to a certain extent, the hair growing cycle and lead to hair loss. It's not permanent hair loss, however, so once those diseases are under control, then there is the opportunity for the hair to regrow. And things that are used to treat dandruff and also psoriasis in the scalp include over-the-counter anti-dandruff shampoos that have ketoconazole in them, like Nizoral shampoo, or zinc pyrithione, or selenium sulfide. These all can help, and then there are, of course, prescription medications that may be offered to treat these diseases. Another very common cause of hair loss is an autoimmune hair loss called alopecia areata. This is a very strange disease, but very common, and strange in the sense that for whatever reason, all of a sudden your immune system decides, hey, let's attack the hair follicles. And this presents with a sudden onset loss of hair, either most often a patch of hair in the scalp, just lead to a frank bald patch. Really, really alarming for patients, really unsettling, very traumatic to go through. And why this happens, we're not entirely sure. But it is pretty common. And the good news, in most cases, the hair grows back without any treatment. There are treatments that can be offered that will increase the rate at which the hair regrows, things like steroid injections into the spots and some prescription medications. But that is not a permanent form of hair loss either, usually. There are some more widespread types of alopecia areata, less common, that affect the individual for life, and they have to go on systemic medications for those diseases, for that disease. So, there's some variants with alopecia areata, the autoimmune hair loss, but the most common presenting type usually is not permanent and resolves. Another very common source of hair loss is related to your hairstyling practices, something called traction alopecia, meaning if you wear your hair in really tight braids or really tight cornrows, you wear your hair pulled up on the top of your head in a tight ponytail, that can actually pull on the hair and cause, obviously, traction that can ultimately scar down the hair follicle and lead to hair loss there. It can be permanent, but in the early stages, if it's identified and you stop wearing your hair that way, the hair will regrow. First, it kind of leads to just breakage and thinning, but ultimately it can, with ongoing stress on that hair follicle, it can lead to a permanent form of hair loss. And that typically happens in the temporal scalp area, as you can imagine, related to pulling the hair back tightly. Heat styling is a source of hair loss, namely because it causes hair breakage, whether it be blow drying your hair or using a flat iron. This will damage the hair shafts. It causes something called trichorexis nodosa, which is basically the hair shafts become very fragile and brittle in the center, and they kind of make this squishy little node in the middle of the hair shaft that then breaks. And so that is related to heat styling the hair. If you do blow dry your hair, a recommendation would be to use the lowest heat setting possible and hold the hair dryer at a distance of 15 centimeters from your hair. That was actually shown to be the least damaging to the hair. So that is the best practice for blow drying your hair. But a flat iron will cause heat damage on the hair shafts no matter how you use it. And then lastly, another cause is processing the hair, whether it be straightening it, relaxing it, or getting a perm. These chemical treatments on the hair can definitely affect the hair shafts themselves, for sure, leave them very brittle and susceptible to a lot of breakage, but also depending on the hair processing, specifically relaxers, if these chemicals get in contact with the scalp whatsoever, they can be they're very caustic and can damage the hair follicles and actually lead to a scarring type of hair loss. So hair processing is certainly a cause of brittle hair and hair breakage, but also with time can affect the scalp and lead to inflammation, irritation, and damage to those hair follicles in your scalp. But I can give you some practical tips that perhaps you can put into place that might help some of these things. Number one relates to shampooing of the hair. It's actually a delicate balance between overwashing and underwashing the hair and the scalp. Overwashing, meaning you're shampooing too frequently or too often, can dry out the hair shafts quite a bit and lead to breakage. Also can cause dryness in the scalp. It's irritating, may cause you to scratch your scalp, and that can cause hair breakage up close and more hair loss. However, not shampooing enough can lead to a buildup of oil and overgrowth of that little yeast called Malassezia that lives on everyone's skin. And that overgrowth of yeast leads to a lot of inflammation in the scalp and causes dandruff, as well as contributes to certain types of hair loss. So it's a delicate balance, and the balance is up to the individual because it's going to be guided by your hair type. If you have an oilier scalp, an oilier hair type, you're going to tolerate, most likely, shampooing more frequently. But if you have a hair texture that does not withstand frequent shampooing, it's something that you have to kind of have to calculate how often you're able to get away with it. That way you're balancing cleansing the scalp and removing oil and buildup from the scalp and the hair shafts, but not overdoing it such that it wreaks havoc on your hair strands and your hair texture. The second tip is to make sure that you are using a conditioner. Conditioners have things that coat the hair in them and actually reduce static. So your hair, particularly when you brush it, it deposits negative charges all over the hair, and that leads to static that can cause breakage. Conditioners actually deposit a positive charge all over your hair that kind of reduces that static. And conditioners also have things like hydrolyzed proteins in them and silicones that deposit on the porosities of the hair and strengthen the hair and also give some shine and luster to your hair. But you just need a little bit and just direct it to the ends of your hair. You don't want to use too much because that actually can weigh down the hair shafts and lead to more breakage. So it's a delicate balance, but using conditioner on the ends of your hair will definitely help in reducing hair breakage. Just don't go overboard. And then my last tip would be to make sure that you're styling your hair very gently, not wearing tight ponytails or tight braids, just letting your hair be down. Gentle hairstyles that don't put a lot of traction on the scalp, ponytails and things like that. You do want to get your hair off of your face because it's annoying. So those are my tips and tricks for hair loss, some of the most common types of hair loss. But again, make sure you see your healthcare provider for evaluation and management. Really important to nail down a diagnosis as to what is causing your hair loss rather than self-diagnosing. But I hope this video was helpful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.